This topic is cardiogenic shock. So I want you to remember all the parts of hypovolemic shock. Remember? Okay, now let's talk about cardiogenic shock. I want you to think of the word cardiogenic. Cardio, heart. But I also want you to think of cardio at the gym, muscle. So this is cardiogenic shock. It's the inability of the heart muscle to properly contract and push that blood out of the heart. That results in decreased cardiac output and decreased tissue perfusion. That results in an activation of the compensatory mechanisms, the sympathetic nervous system. So what causes cardiogenic shock? Anything that causes damage to the heart muscle. It can be myocardial infarction, that blockage in the vessel, so now oxygen and blood can't get beyond that blockage, causing damage to that heart muscle. Decompensated heart failure. Those ventricles just don't have enough strength to pump that blood out of the heart, or they're so stretched out they can't do it. Cardiomyopathy. This is a disease of the heart muscle, which makes the muscle not able to do what it's supposed to do properly. Valvular heart disease, like acute mitral or aortic regurgitation. The valve leaflets aren't working properly, so blood, as it's being pushed through, is allowed to go backwards, and that causes stress on the heart. And then arrhythmias, like atrial fibrillation, where the heart is not being innervated properly to contract fully to empty itself completely of blood. And then any trauma to the heart. Clinical features of cardiogenic shock. The heart muscle isn't pumping properly, so the tissues aren't being perfused. It's impaired perfusion. So they'll have hypotension, they'll have weak pulses and cool, clammy skin, they'll have tachycardia in response to the hypotension. They'll be pale or cyanotic, they'll have delayed capillary refill, and decreased urine output. With impaired perfusion, the brain is also impaired, so there'll be changes in level of consciousness. They may be anxious or agitated. And pulmonary congestion. Let's talk about that for a second. So cardiogenic shock normally happens where there's an injury to the left side of the heart. If that left side isn't working properly, it's not able to pump that blood out, so it's decreased cardiac output. That blood then gets backed up into the lungs. So we see clinical manifestations in the lungs. Dyspnea and orthopnea, tachypnea and hypoxia, and then crackles. Why crackles? Because that fluid is backed up to the lungs. Now, if it's backed up to the lungs, it'll also get backed up to that venous system, and you might see jugular vein distension or peripheral edema. Diagnostics for this look for the damage to the heart, the ECG to assess for the myocardial infarction and arrhythmias. A chest x-ray to look for the gross anatomical changes or pulmonary congestion. Echocardiogram, that will look at the function of the heart. It'll be able to determine the strength of the heart and also look at heart valve function. BNP or proBNP to assess for heart failure, and then cardiac enzymes, which will be elevated if the client had a myocardial infarction. Remember all of those stages of shock: initial, compensatory, progressive, and irreversible. If we don't intervene quickly and effectively enough, that client will progress through all of those stages, resulting in complications, like multiple organ dysfunction from lack of perfusion, arrhythmias, cardiac arrest, and death. We want to intervene as soon as possible to stop the progression of shock. If we start to see our client experience those clinical features, we want to start to intervene. Interventions are dependent upon the cause of shock, and we want to correct that cause. We want to prevent complications by increasing oxygen delivery and decreasing oxygen demand. We can elevate the head of the bed and provide supplemental oxygen. We want to transport as much oxygen as possible. We'll monitor intake and output. to determine renal perfusion, and the client will also be on cardiac monitoring to look for those dysrhythmias, and then we can treat those dysrhythmias. We'll provide vasopressors to help with hypotension and prepare the client for potential intubation and mechanical ventilation. Some of these clients may also need surgical intervention, like percutaneous coronary intervention, as seen here in the illustration. You can see here that they go up through the groin into the arteries of the heart, place the stent, deploy it, and that opens the artery. So now blood and oxygen can get through that area. The client may also need valve surgery to correct that mitral or aortic regurgitation. So for cardiogenic shock, I want you to remember, cardiogenic is heart muscle problems. The muscle of the heart is not working properly, so the body compensates for that. You got this. Keep up the good work. I'm proud of you.